I'm gonna go ahead and get started. Okay, are we recording? Yes. Welcome. Thank you for coming. Thank you for your support. Today we're going to be talking about intergenerational trauma and its impact on the mental health of Black Americans, specifying Black Americans because intergenerational trauma isn't a phenomenon that is like exclusive to us. Actually, fascinatingly enough, a lot of the scholarship available on intergenerational trauma is mostly for Jewish people and descendants of the Holocaust. That was where most of like the research is, which I thought was pretty interesting. And that's I'm getting to that, even though like intergenerational trauma is something that can be experienced by anyone. So today we're gonna be talking about it in relation to Black people and how it impacts our mental health. So just the basics. What is intergenerational trauma? It's pretty much the physiological passing down of trauma. Think of like you have like a trait, like we inherit traits and like personalities from our parents, but we can also inherit trauma and it's like coded in our DNA. And so that's called epigenetics, which is the way that our environment can impact our DNA. So it's actually pretty crazy where say you're growing up, okay, slavery, that was like the first thing that started the trauma snowball. I'm going to be referring to it as a trauma snowball. That's like not a funny thing. It's like it sounds funny, but it's like a genuine, like it's a snowball effect. So you have slavery, that environment, that horribly traumatic environment can alter the DNA of the person who experiences what's called the initial stressor. And so the person who experiences the initial stressor will pass down that DNA mutation to their kids, and then they'll pass it down in compounding with whatever they experience to their kids. It just goes and goes and goes. And so it's how our environment can physically alter our DNA in the way that like we exist in this world. And that could be, it's called fetal PSD. So if you're thinking of like a mother who was a slave, she's pregnant with her child, right? And while she's pregnant with her child, she's experiencing all this other stuff going on, and that's impacting her baby in real time. And the baby is born with the effects of a trauma that they didn't even experience firsthand. And then they grow up and they like, it just keeps going. So that's what intergenerational trauma is. And like I said, any group can affect it. Most of the research is from people who experienced the Holocaust because it is the same thing, right? But there's very, very little research on intergenerational trauma in slavery and Jim Crow with Black Americans. So a lot of this, like I had to piece together. So where does it start for Black people, right? Slavery, transatlantic slave trade. It's pretty much the obvious answer. I don't have to get into the details of how traumatic and terrible that was. But it also starts with colonization and imperialism. Thinking about the act of colonization by like the British and Spain and the French all over the world. All of that ravaging, all of the genocide, sparked the intergenerational trauma for a lot of groups of ethnic people all over the world. So we're not probably even the ones who are affected by this. But it continues, right? So starting with slavery, the snowball grows with Jim Crow. So the legalization of racism, the institutionalized criminalization of Black people and our discrimination. So seeing lynchings every single day, right? Just being afraid to walk around and not be abducted and murdered by the KKK. Getting like an environmental racism they faced. Around this time is also like the post-war Reconstruction era. And so that's when segregation was really solidifying, and as Black people were gaining their freedom, they faced a lot of institutional barriers. That was like kind of the beginning of what we experience today, that kept them from exercising their freedom. So you would have people who were technically free, but their slave masters didn't even tell them that they were free yet. And so they would be enslaved for 5-6 years after they were free, and that trauma continued. So there's this overlap, right? So the trauma from slavery didn't hard stop at 1873. It carried on. But while that happened, other Black people in other places who were free, who did get their freedom, were dealing with the newly like legalized form of racism and discrimination. So two different types of trauma overlapping, and that shows up in us in different ways. So if you think about like my family, I think my genealogy stayed in the South, but people whose diaspora ended up like in the North and in the South and different parts of the US, all those different traumas that were experienced in those different places funnel down into us every day. And it continues with state violence. So kind of going to the 80s, 90s with the war on drugs, that whole thing. And we know how that manifested and directly targeted Black people and Black communities with the over policing. So now we're starting to see a more blatant and regular how we currently conceptualize policing in the US. And it's all just a reimagination of what was experienced slavery, Jim Crow, but stop and frisk policies, right? So again, your environment, the way that you're living in your environment and the way that your environment treats you, walking around, being a cop can just stop you, frisk you, that escalates, right? That trauma, that stress is altering your DNA in real time in ways that we're not really taught about, right? And so the snowball grows even more to now what we experience, stop and frisk no longer exists, but the carceral state still lives on in many ways. And we have experienced like a weird normalized pseudo racism now, right? Where it's not like it was back in Jim Crow, where like someone can stop me and, well, I'm saying can't, but still happens. Someone can stop me and like beat me in the street, right? Still happens, but again, the overlap. But it shows up in a different way. So like microaggressions, we already know about that. Like, oh my gosh, I didn't expect you to say something so smart, or things like that. Your name is really, how do you pronounce that? Lee. I'll just gonna call you Jay. Stuff like that. That grows the trauma snowball. Normalize racism in media, the way that we are portrayed in media, and the way that we exist in media furthers, it perpetuates this racism and the trauma that that has on us. And even the way that Black people, the space that we take up, and like literally just like movies, like what is our media about? If we are seeing on the news, like for example, I was watching NBC the other day and it showed a video of an unhoused person who was murdered by a police officer in 2019. They showed the video. They just put it up. They said, now warning, this might be traumatic for some viewers. Like, hey, so maybe don't show it. I don't know. Stuff like that. Being able to see images of people like you being murdered just on the internet. That is traumatic, right? And it's stuff we experience every day. Talking about the desensitization of that. We're used to it at this point. That the way that we are desensitized from images of Black people experiencing violence is a manifestation of intergenerational trauma, because it's like we've been there before, but we haven't. That feeling you get in your stomach when you're watching those videos, when you're learning about slavery in class, where it's like in your gut and you're like, this just doesn't feel right. That is intergenerational trauma. That is your actual ancestors who did experience it, the way that their DNA was mutated, that DNA is now in you. You are experiencing it as if you were there for the first time. Which is kind of it's a really interesting physiological way to explain that gut feeling Black people get when we're talking about this. Like it's not like a fake made up thing. Like it's in our DNA. So to kind of visualize this, we have a little family tree by generation to really get into the generational part. So we have like a grandmother, that's the boomer generation, then Gen X has like 40s, like our parents around there, and then millennial Gen Z, which is where we are. So we have the Jim Crow, excuse me, civil rights movement around the 60s, also just war. Don't need to highlight Jim Crow. We already spoke about that. Civil rights movement, pretty self-explanatory, but war was especially it was an especially interesting stressor, because Black people were going to war, World War One, Two, North Korean War, Vietnam, or the Korean War, Vietnam War, child do I need to continue? And we're being sent off to fight in these wars for a country that didn't care about us. We're dying. And those who did not die came back and faced the same racism, like they didn't just put their life on the line for a country. That is traumatic. We carry that with us. Seeing your loved ones going off into war, and experiencing racism abroad while they're fighting for the country, right? Like Tuskegee Airmen. You're familiar with them, World War II pilots from Tuskegee. Amazing, saved the US multiple times, right? Still face racism. So there's that. And so we come down here further. We have 2 children right here, stop and frisk. We already went over that. Rodney King, that's the first kind of, I would say, the catalyst in like police brutality, police violence, filmed shootings of Black people, right? That shook that generation. That experience, they carry that. And then the HIV and AIDS epidemic. So many Black people, specifically queer Black people, died and suffered, and it was an epidemic. It needed to be addressed, right? But Black people were just being left to die. That is traumatic. We carry that with us. And now we have, with like the election of Barack Obama, I have that on there because that is a marking point for that new racism that we experience, right? Those cartoons, those caricatures of like Barack and Michelle Obama, the fact that they were in the White House, the racism they got, we got. So like when I was in elementary school, I was 8 years old, 3rd grade. I'll never forget it. One of my classmates asked me, are you voting for Obama? First of all, I'm 8, so I'm not voting for anyone because I'm in 3rd grade. But the racism that I experienced, that they felt towards the Obamas, translated to all of us, right? Like we all have stories of when the Obamas were running and when they were elected, that we were experiencing that too. We carry it with us. Trayvon Martin, that was our Rodney King. I was like a kid when that happened. I was 11, 12 years old. And then just the carceral state, witnessing over policing, the filling up of a prison, school to prison pipeline. None of that is new, but it is much more pervasive now, and we're carrying that. And so that's kind of just like a visual aid. And even before the grandmother, you have sharecroppers, you have slavery, like it just goes on and on and on. As the white supremacist institutions continue, we will continue to carry the effects of it. So just moving forward to mental health, right? How does all the stuff that we just talked about, how do we carry that, and what effect does that have on us on a daily basis? So it affects us mentally, right? We are experiencing trauma. PTSD has multiple effects, and it can manifest in multiple ways at multiple mental illnesses. So that can look like depression, anxiety, PTSD, schizophrenia. Schizophrenia is very common among Black people. ADHD, ADD, dyslexia, and other like learning conditions or learning disabilities. Those are all manifestations of our intergenerational trauma. And there are ways that they can impact us, but like we don't really address it, right? Black people are not appropriately diagnosed because of medical racism. We have all these conditions, all these experience, or all these illnesses without even knowing it, because we are not appropriately diagnosed. We do not have access to the mental health treatment, the medical care that would be like, hey, you're exhibiting some symptoms of anxiety, of chronic anxiety, of schizophrenia. Let's get that treated, right? And in addition to that, Black children are less likely than white children to have their symptoms actually and accurately identified. Emphasis on accurately identified, because Black children will be exhibiting symptoms of ADHD or ADD, or really even anxiety and depression that can show up as like having an attitude, or just being moody, or really being fidgety, or acting out in class, but get either sent to detention, ISS, labeled as put in like remedial classes. Meanwhile, a white child exhibiting the exact same symptoms, like, oh, they might have ADHD, they might have ADD. We should get them tested for a mental illness. Meanwhile, the Black child exhibiting the same thing will be reprimanded, right? When they need to be treated and handled with care because they're a child. And so of course the child is going to act out. They're not going to know how to manage themselves because all children are children. But because of the body that child occupies, their diagnosis is handled differently, or their symptoms are handled differently. So in addition to medical, or in addition to diagnosis, what deters people from seeking treatment? Because we all experience it. Most of us experience these symptoms without even knowing it, or we do know it, but it's categorized or dismissed in a different way. So medical racism, a very well-known example of that is the Tuskegee syphilis study, where 600 Black men who had syphilis were were in a study, by a government study, to develop a vaccine and treatment for syphilis. The vaccine, it was developed, they just never gave it to them. They let them suffer. They let them give the illness to their children. They let them die in the name of science. That medical racism. They have the treatment, they have the way to help these people, and they just didn't. And they treated these Black bodies as test subjects, right? Even though these are people. That really, really disrupted the trust that Black people have in any medical institution. Like even to this day, like my granny, we go into the doctor with her. She's not about it. She's really not. She's like, why am I going to listen to them? They're not here to help me, right? And so that's like a really well-known marker in our distrust. And it goes before that. Tuskegee syphilis study is not the first time that happened. They did medical experience on slaves. University of Georgia, where I'm from, their medical school, they practice on slaves and Black people during Jim Crow. Like it's very normal for the medical field to use Black people like lab rats, which is ironic because a lot of our medical symptoms for diseases like heart attacks is a very, very common one that people know about. Those symptoms are made for like white bodies. So like symptoms for things show up differently for us than they would for maybe other people. But despite all the experimenting they did on us, they still don't know how our bodies work, which is interesting to know. And so in addition to that, Black women in birth, Black women are over 200% more likely to die from childbirth than a white woman, or any person really, and that figure hasn't changed since the 1940s. And it probably was the same before that. Black women enter childbirth with the expectation or with the knowledge that they may not make it out of there, and it's just a normal thing. It's just normal for us. And so in addition to that, the Black infant mortality rate. So even if the mother makes it, their child, the Black children or Black babies are twice as likely to die within a couple of days of being born, just because of lack of attention, lack of treatment. And that looks like, and I think when a lot of people are thinking about and talking about medical racism, they think it looks like a doctor coming in like, you're Black, I don't want to treat you, and then walking out. Thinking about that pseudo racism now, these doctors, medical professionals, and also like mental health practitioners genuinely think they're providing equal care to everyone, but these unconscious biases are coming out where it's assumed that Black people can handle just more pain. So if a Black person is a Black mother after giving birth is like, I don't feel, something doesn't feel right, like I feel really sick, like I'm in a lot of pain, like, oh, we'll get someone to you in a few minutes, like she'll probably be okay, just keep doing that, she'll be okay, she'll be fine. And then she passes away because it's assumed that we can just handle more. We're just built for more. They'll be all right. Same thing with the baby, knocked down lower on the priority list. Again, it's not on purpose usually, right? It's not an intentional conscious choice, but the way that our medical institutions are set up, we are not it's just the way that they're taught to handle people, handle these patients. It's also assumed that Black people are dishonest, that we're lying about our pain. We don't really feel bad. You just wanna, you're just lying and saying that you're upset so you can get a prescription for something, and then you have drugs and you'll sell it. Like, nah, I just need some antibiotics because I'm pretty sure I'm pneumonia. Like, stuff like that, where because of these unconscious biases from Jim Crow, from media, from the way that we are portrayed and the way that we exist like within our society, that translates into medical institutions and the way that we are treated. And putting it in the context of mental illness, you go into a therapist's office with the therapist who is not Black, and you're talking about how all just seeing all the shootings, all the death, all the violence, trauma movie after trauma movie after trauma movie coming out, and it's just wearing on you because of the lack of cultural competency in the field to understand the way intergenerational trauma impacts us on a daily basis. Your concerns, your feelings, your not feelings, but the way that your brain is processing this in a way that is out of your control, right? It's your DNA. It's physiologically just how you're wired. You're not taking it seriously. You're going into a therapist's office talking about all this stuff like, oh, well, maybe just like turn your phone off and just don't really watch the news for a couple days. It's not that easy. It's not that simple. And so the way it's important for medical professionals to have the cultural competency to know what Black people are carrying every single day and how that impacts the way that we live our lives and in our daily interactions, how those microaggressions, if you're going into a therapist's office and a student says, like the example I gave before, I didn't expect you to ask such a good question. Oh my gosh. And when you're going into a therapist's office talking about how that affected you, they need to understand to what extent that really deeply affects you, like from at the most basic level, at your DNA level. Stigma, as y'all know, already additionally plays a role in this. So within our community, the way that we have internalized the way that medical racism has impacted us has kind of transformed into the stigma that mental illness, mental health treatment is just not for us. Any sort of treatment for that, it's just not, that's a white people's thing because it's not meant for us. So like that's a common phrase. I'm sure y'all have heard it before. Also using religion as a replacement for treatment. You're not feeling depressed, you're not feeling anxious, they probably need to pray about it. Or even just an emphasis on self-sufficiency. Again, it's assumed that Black people can just handle more. We're just built for more pain, for more hardship. It's fine. So you don't need to go to therapist. You got it. You can work through it on yourself. I believe in you. You can get through this. No, like we're carrying centuries of trauma on our backs every single day. We need to go to a mental health professional to work through this. That's nothing that even a wonderful church community, a wonderful support system, they did not go to school. They're not licensed. You need help, right? And even people who can identify things in us that we didn't even know about. So the denial of own mental illness. You'll see the more that you do, I encourage y'all to do more research about this and just the way that symptoms of mental illness shows up differently for Black people. That in doing my own research, I've been able to identify some of those things in people in my life. And I'm like, we've been denying ourselves the treatment that we deserve because of these institutions that have been denying it to us. And so we assume that we don't need it, but we do because they have decided that we don't. So that's how stigma can also affect us seeking treatment. So that's pretty much all I have in terms of content. I'm gonna go ahead and stop recording so we can get into the conversation just to protect y'all's privacy. But thank you so much.